Hello dear students, welcome to the class on opioid analgesics. In this class, let's learn about morphine adverse effects, precautions, contraindications and drug interactions. So at the end of this class, what are the specific learning objectives you should be thorough with? At the end of this class, you should be able to enumerate the adverse effects of morphine, describe the acute morphine poisoning and its treatment, explain the tolerance, dependence produced by morphine, enumerate the precautions and contraindications for the use of morphine, and mention the drug interactions associated with morphine. So coming to the case study 1, a 29-year-old female was administered morphine during labor for pain relief. Mother brings her 6.5 week baby to casualty due to episodes of breath holding spells, cessation of breathing for 20 seconds with reduced activity, and looks cyanosed as well as paler. So going through this case, what is your diagnosis and how do you treat it? And what is the probable reason for development of these symptoms? So please think over this case. Let us discuss this case at the end. So coming to the morphine adverse effects, it can cause side effects, it can cause idiosyncratic reactions or allergic reactions, it can cause apnea of newborn, it can cause acute morphine poisoning, and it can also lead to tolerance as well as dependence when it is used for a prolonged time. So coming to the side effects associated with the morphine, it can produce sedation, mental clouding, lethargy, and also it can produce subjective effects which can also include dysphoric behaviors, and also it can lead to respiratory depression, blurring of vision, urinary retention, especially in the elderly male patient, and also in some of the individuals it can lead to vomiting, which is occasionally in recumbent patient, and it can lead to fall in blood pressure, especially in case of hypovolemic patient, and if he or she walks about. The most common side effects which is encountered with the morphine is the constipation, which is very distressing. So this is the diagrammatic way of representation of morphine side effect. It can cause sedation, mental confusion, lethargy. These are the subjective effects. It can lead to vomiting, it can lead to blurring of vision, respiratory depression, urinary retention, hypotension due to vasodilation, and the most common being the constipation. So coming to the idiosyncrasy and allergy. So allergic reactions usually manifest as urticaria as well as lip swelling. So basically, it can lead to injection site reactions. They are also called as local reaction to the injection, which causes generalized itching. The reason being due to the release of histamine. And also the intrathecal morphine administration can also lead to itching because of activation of pruritoceptive neurons in the spinal cord. So coming to the apnea of newborn, why apnea of newborn occurs? Whenever the morphine is administered to the mother during labor, there will be transfer of morphine to the fetus through the blood-brain barrier, because the blood-brain barrier of the fetus is undeveloped. So thereby it leading to the higher concentration of morphine in the fetal brain, which lead to the apnea. Apnea is a temporary cessation of breathing for at least 20 seconds or more, associated with hypotonia as well as cyanosis as well as bradycardia. So how do you treat this condition? You can inject naloxone, which is a treatment of choice, 10 microgram per kg. It has to be injected in the umbilical cord. So coming to the case number 2, 48-year-old male brought to emergency department by his friend, complains of consumption of tablet used to relieve pain. On examination, patient looks stupor, shallow and occasional breathing. Blood pressure was 90 by 70 mm of mercury. Skin color looks light bluish. Eye examination revealed pupil size were reduced. So looking at this case, what is your probable diagnosis and how do you treat it? Please just go through this and think over the case. In the meanwhile, we'll discuss this in the following slides, and will conclude what is the probable diagnosis and how do you treat, how the treatment should be given to this case at the end. So coming to the acute morphine poisoning, these four things should be kept in mind. So what is the lethal dose to produce morphine poisoning? What are the manifestations? How do you treat? And what are the specific antidotes which are available? So in the human, lethal dose is estimated to be around, established to be around 250 milligrams, and in non-tolerant individuals 50 milligram itself can cause poisoning. So what are the manifestations? So manifestations will be the extension of the pharmacological actions, like it can produce stupor, coma, flaccidity, breathing. It will be shallow and occasional. The pupil will be pinpoint pupil, and there will be fall in BP, finally leading to the shock. And also some individual, depending upon the concentration of the morphine which is present in the plasma, it can lead to pulmonary edema, it can lead to convulsions, and finally death can occur due to respiratory failure. So how do you treat these conditions? So morphine, you can remember RP. First, you should give a respiratory support. You should not give oxygen, because whenever the respiration morphine causes respiratory depression. For respiratory center to stimulate, you need a stimulus which can stimulate the respiratory center. Stimulus being carbon dioxide. So oxygen will not stimulate the respiratory center. So you should not give oxygen in morphine poisoning. So other P, you can remember, you should give positive pressure respiration, so which can help in relieving the pulmonary edema by shifting the blood from pulmonary circuit to a systemic circuit. And also blood pressure can be maintained by using intravenous fluids. And also you can administer potassium permanganate, which is used as a gastric lavage to remove the unabsorbed drug. So in case of morphine, again you can remember pH. pH stands for pH of the morphine is basic. How to remember is, if you count the letter in the morphine, it is the 8. So pH 8 means is a basic drug which gets ionizes in the acid gastric juice. Thereby it prevents the back diffusion. It prevents the back diffusion into the blood. Thereby whenever you use a potassium permanganate, you can easily remove the unabsorbed drug from the stomach. So what will be the specific antidote for the acute morphine poisoning? You can use a injection naloxone, which is a synthetic opioid drug, zero point 0.4 to 0.8 milligram every 2 to 3 minutes. It can be repeated till the respiration picks up. Because of their rapid action and the short duration of action, you need to repeat this drug every 1 to 4 hours depending upon the response. So coming to the tolerance and dependence, so morphine produces a high degree of tolerance when the morphine is taken repeatedly. So thereby the rate of development of tolerance depends on the dose as well as the interval at which it is repeated, which can, if the large doses are injected, it will induce the tolerance very rapidly. So what will the reason for development of tolerance? It can be due to partly due to pharmacokinetic mechanism, and major being pharmacodynamic action. So it produces more of cellular tolerance than the increased metabolism. So remember that tolerance developed to all the actions except for 3 C's, except for constipation, constriction of pupil, that is meiosis, and for the convulsion. You should take care of 4th C, that is this morphine can cause cross tolerance, high cross tolerance with the other opioid group of drugs. And also the 5th C stands for concern about the abuse liability. So the major limitations for the use of morphine is abuse liability, and this abuse is more common among the healthcare professional because of the easy access to the drug. So in case of morphine withdrawal is associated with the drug seeking behavior. So what will be the physical manifestations of abstinence? Are it can lead to lacrimation, it can lead to sweating, it can lead to yawning, it can lead to insomnia, it can lead to mydriasis, dilatation of the pupil, it will lead to tremors, goose flesh, it can lead to anxiety, fear, restlessness, aggression, and also it can lead to diarrhea. It can lead to dehydration and rapid weight loss. So in such conditions, you can immediately administer opioid. So you should administer immediately the opioid agonist in such manifestations. So administration of an opioid at this time immediately will terminate the morphine withdrawal. So and also you should remember that you should not to use opioid antagonist because it will again precipitate morphine withdrawal syndromes. So you should not use naloxone or nalorphine, which is an opioid antagonist. So what will be the treatment? So treatment consists of you should withdraw the morphine and substitute with the oral methadone, which is a longer acting, long acting opioid, which is given orally. But the cravings for opioid may persist, and sometimes it can lead to relapse also. So how this methadone helps in relieving the dependence as well as the addiction. Since it has got slow and persistent nature of action, the sedative and subjective effects are very less intense, and also it probably incapable of giving a kick, and also the development of abuse potential is very low compared to the morphine, and also the tolerance which develops is very low because of progressive filling of the tissue stores, and withdrawal syndromes is of a gradual in onset. It takes around 1 to 2 days after discontinuation, and also if it develops also the symptoms will be less severe. So apart from this, once the tolerance developed, it can go for addiction, it can lead to dependence, finally leading to the abuse liability. So coming to the MCQ, chronic morphine abusers develops tolerance to the following actions except. The answer will be the exception is constipation, 3 C's. If you remember, 3 C's: constipation, constriction of the pupil, and convulsion. So coming to the precautions and contraindications, you should take precautions while using infants and elders with case of respiratory insufficiency, bronchial asthma, hypotensive states, undiagnosed acute abdominal pain, elderly males, diseases associated with liver and kidney, and unstable personalities. And coming to the MCQ, pick the absolute contraindications for the use of morphine. So absolute contraindication being it is the head injury. Remember, it is the head injury which is the absolute contraindications for the use of morphine. The reason we are going to study in the following slides. So coming to the infants and the elderly, because it can cause respiratory depression very easily. In case of respiratory insufficiency, the conditions like emphysema, pulmonary fibrosis, car pulmonary can lead to death by increasing the risk of sleep apnea, and also mainly due to the hypoxic brain damage. Coming to the bronchial asthma, patients with bronchial asthma can exaggerate the symptoms due to the release of histamine from the morphine. Therefore, if the situation requires the use of opioid group of drug, you can use high potency opioid with low histamine release, example fentanyl. So hypotension can be exaggerated in case of hypotensive as well as hypovolemic state, and also in case of elderly men you should be very careful, it can lead to urinary retention. And also in some of the disease conditions, like especially the hypothyroidism and diseases associated with liver and kidney, they will be more sensitive towards the morphine. And also in case of unstable personalities, there will be higher chance of developing addiction. So coming to the case study number 3, a 40-year-old female comes to casualty with the complaints of sudden, rapidly intensifying pain in the upper right portion of the abdomen, and also pain between the blades of the shoulder blades with nauseating sensation. She has a past history of surgery for gallstones, and postgraduate immediately asked nurse to give injection morphine. So just think about this case and tell me whether the instructions which is given by postgraduate to the nursing staff is right or wrong. So in case of undiagnosed abdominal pain, you need to avoid using the morphine because it can aggravate the certain conditions like biliary colic, pancreatitis, diverticulitis, as well as inflamed appendix leading to the rupture. Because since This morphine being a strong analgesic, it can mask the pain sensation through central mechanism, but the underlying pathology may remain as it is. So that's why in case of undiagnosed abdominal pain, you should avoid using morphine. Once the diagnosis is made out and you rule out all these conditions, you can make use of morphine. Otherwise, you can go with other drugs like buprenorphine, or you can go with pentazocine, which are less likely to cause biliary spasm. So coming to the case study for a 23-year-old male met with a road traffic accident and was brought to casualty by local village people. Emergency care specialist asked the intern posted there, can we administer injection morphine in such case before assessing the patient condition, so that morphine produces strong analgesic action. Just think over it why the emergency care specialist has asked for the administration of morphine, and whether you should avoid the administration of morphine in such cases. So coming to the morphine, so the absolute contraindications for the use of morphine is head injury, because in case of head injury it can lead to a rise in intracranial tension, because since it causes respiratory depression, it can lead to carbon dioxide retention, and also morphine will interfere with the diagnosis as well as the assessment of the condition, because it can induce vomiting, it can lead to meiosis, it can lead to altered mentation. So coming to the drug interaction associated with the morphine, some of the drugs can potentiate the morphine activity by retarding the metabolism of morphine. Example, phenothiazines, tricyclic antidepressant, MAO inhibitor, amphetamine, and neostigmine. And when morphine is combined with sedative hypnotic, it can exaggerate the CNS depressant action. And also, this morphine will retard the absorption of certain drugs which are given orally, because it delays the gastric emptying. So coming to the case number 1, here is a case where a female patient, while labor, the morphine was injected to relieve the pain, but after the few days, a 6-week baby complains of breathing difficulties, cessation of breathing, and also reduced activity. What will be the cause? It is the case of apnea of newborn. Apnea of newborn, because whatever the morphine is administered can be travel to the fetal brain, because the fetal brain is not having a properly developed blood-brain barrier. So that's why the morphine can easily cross from the mother to the fetus through the blood-brain barrier. So what will be the treatment for that? Treatment will be the naloxone, which has to be given to the umbilical cord. Next, coming to the second case, a 48-year-old male brought to emergency department, complained of consumption of tablets to relieve pain. All these features, hypotension, skin color, especially the pinpoint pupil, all these features goes towards the diagnosis of acute morphine poisoning. Here the antidote will be the injection naloxone. It has to be given 0.4 to 0.8 milligram IV. So this will be the specific antidote, which is a opioid antagonist. So coming to the case number 3, a 48-year-old female comes to casualty with complaints of sudden intensifying pain in the upper right portion of the abdomen and pain between the shoulder blades and nauseating sensation, and history of gallstone operation previously. And PG immediately asks to nurse to give morphine, whether it is justifiable or not. So since PG is asking for morphine, it should not be given, because since she is having gallstones, in case of undiagnosed abdominal pain, it can it can increase the biliary colic. Even though it relieves the pain, the underlying pathology may be masked. So coming to the case number 4, a 23-year-old male with road traffic accident and brought by a village people. In the emergency department, the specialist asked the intern, can we administer injection morphine before assessing the patient condition, so that it will provide a strong analgesic action. So here the intensivist is checking for the knowledge of the intern posted there. In case of road traffic accident, if there is a head injury, say no to morphine. If there is no head injury, you can go with morphine. Otherwise, in case of head injury, the morphine is contraindicated. I hope all the specific learning objectives are met so that you should be able to describe all these learning objectives without any problem. Thank you.